HIPcast is brought to you by Enterprise Social Record, and today's episode sponsor is FairCode. Are you looking to maximize your hospital's revenue and streamline patient documentation? Introducing FairCode, your trusted partner in DRG reimbursement optimization. FairCode's 100% board-certified physicians collaborate seamlessly with your coding, CDI, and medical teams to conduct lightning-fast chart reviews pre-bill and post-discharge to ensure accurate reimbursement. Only 10 to 15% of the chart's FairCode reviews requires changes, yet their recommendations result in a significant boost to a health system's cash flow. Worried about risk? Try FairCode's 13-week trial. If they can't pay for their services, they'll keep reviewing charts until they do. And by the way, historically, FairCode's 13-week trial leads to ongoing partnership with a remarkable 3-to-1 hard dollar ROI. Don't miss out on the opportunity to enhance your reimbursements. For more information about FairCode and how you can experience the maximum in healthcare revenue optimization, contact Steve Hansen at 615-600-2166.
Hey, Seth, do you ever feel kind of weird with the guests and myself just staring at you while you read?
Well, the good thing is I'm reading, so I'm not paying attention to what you guys are doing. That's a funny question that now I'm going to be very aware of it.
I know. You're welcome.
You have a second career on the way that you
Doing-
Oh man.
You know, the voiceover side is fun, but the problem is the accent. Nobody wants this unless I'm doing it for like the hillbilly market. Come on down and eat our ham sandwiches at the hillbilly market.
You know you're offering spam. Don't even talk about ham.
I love
Come on
spam.
now.
Spam is so good.
Oh, it's disgusting, but anyway, here we go. Well, we are here today with our guest, Susan. Hey, Susan. Glad to have you back. Susan has been with us before for a totally different person. And today we are going to talk about DirectTrust and direct messaging and cyber and IT and health IT, all kinds of amazing things. Susan, you do really fantastic work. And I'm so glad to have health information professionals at your level in this work on the national scene and the work groups that you're part of. And it's really cool to have you here. So thank you for joining us.
Thank you. I just like, you're.
Wait till you get to the bio part. That's the hard part.
We're going to get.
Oh,
That's it. Well, I don't know. You might get uncomfortable as I read your bio. So I'm going to read your bio for people who may not know you. Okay, so bio. Susan, known as the Health IT Rockstar. Her 30-year career has spanned from her beginnings at a clinic front desk to managed care operations, EHR implementations, privacy and security, health information management, health information exchange, Medicaid and public health technology, and federal and state policy and advocacy. This diverse background has formed the perfect stage for Susan to observe the entire healthcare ecosystem, enabling her to transcend traditional silos with an understanding of the dependencies and the impacts on multiple stakeholders. In her current role, she advocates and fosters a community for the exchange of trusted, secure information through the use of standards and accreditation. Susan has served in multiple volunteer positions, including as president of the Indiana Health Information Management Association, HIMSS Indiana chapter secretary, on the AHIMA nominating committee, and as the chair of the AHIMA Policy and Advocacy Council. Susan, again, thank you. Susan is a friend and a colleague, and I share some other things with Susan. I will admit I haven't been to book club in quite a long time, but I do have a book club that I attend with Susan when I'm, being good. But it's not really a book club. It's a health IT policy club where we call it a book club, but we really just tear through some incredible health policy discussions with several incredible women. Joey Rios is you are also one of the kind of moderators now, aren't you?
Yes, because she's doing a lot of other things, so I'm doing it.
Very good.
Book club that reviews health IT policies. That sounds like a club that needs some cocktails.
Who says there's not cocktails? There's
Oh, good point.
happy hours all the time, Seth.
I don't judge. However you want to do it. I mean, federal rules is always better.
Speaking up, no, I'm kidding. Water. I promise this is water.
The origin of it was I worked for a regional extension center when meaningful use came out. So that was where I first learned to read policy. And so the team I worked with, anytime a new rule came out about that involved meaningful use, we would like assign parts, and you read about, the whatever objective, and I read about this objective, and then we all come back together. And so now as kind of a team of one for advocacy outside of our consultants at DirectTrust, I didn't have capacity to read every single rule that came out. So I had this cool group of friends through the Hit Like a Girl podcast community that I said, hey, we could do this together, that whenever there's a rule that came out, like let's kind of look at it from different angles and everyone come with a different perspective, and what does this mean for the whole of the industry. And now through the use of AI tools, that's a whole game changer. I wish I would have had that in 2011.
No kidding. Yeah, our regional extension centers may have been even more productive, right?
Well, that's a great idea, though, to have that, and everybody takes it in chunks. And instead of, I
really
always tell people, when I was a privacy officer, the weekend reading the Federal Register was not uncommon, and that's going to be so much easier.
Everyone duplicate that. I mean, at some point you do they have to go back and read exactly what it said to make sure you get your comment squared. But it's a really great place to start, to just get the understanding of where you need to go back to.
And to have the different perspectives. Everybody's got a different viewpoint on it. So to have that conversation is so valuable. Now I'm jealous that I'm not part of this group.
Listen, it's really cool, Seth. I'll tell you, it's the different perspectives and also the different backgrounds of all the people. We're all focused on a particular area of concern. And so you've got IT minded, you've got data structure minded, you've got policy and regulation from federal versus state. Like, you've got all these various components, and it really, the conversations really are fascinating. But I know we're not really here to be touting the book club, but it's pretty awesome. So people should be trying to join it. I'm just saying. But I'll let you carry on, Seth.
All right. Well, I'm intrigued, but all right. So let's start. You mentioned DirectTrust, and DirectTrust is a big thing. It's a big industry organization. But for those of us that may be in the audience that aren't quite sure what DirectTrust is, let's go there. What is DirectTrust?
First of all, it is not a bank. When I first came to work, someone asked me, "You work for a bank?" No.
It's great.
I love that.
So it is everything about trusted health information exchange, but really what a lot of people know it for is direct secure messaging. So that was, which kind of, we talked about those regional extension center days. So in the meaningful use era, it started as there was the direct project. It is how the standard was born for how those direct messages are, the protocols for them. So all EHRs at this point, it's in the certification. So if any EHR that's certified has to have the capability to exchange direct messages. So it doesn't mean it's turned on. That's a whole other issue. Turned on, know how to use it
now. Easy.
Your providers in the directory, all these things. There's a lot of factors we could talk about. Once I do the overview, but it really is. A cool thing about it is that it's an agnostic transmission message. It's a push messaging mechanism. So it's like, I know we have this mutual patient, and I want you to know something about it, and I find your endpoint. So we accredit HIPs. So information service provider.
Yeah.
So anyway, they are accredited to be able to issue direct message or direct addresses to usually providers, but not necessarily. Like we have a lot of social care. I'm pointing at Shannon because I know it's the world. We have a lot of social care providers that do it, but there's even a few people can use them as a patient. So it is a secured mechanism that checks the endpoints, make sure they're secure. We know who it is. We know who's sending, who's receiving, and then the transmission. So this is my very layman's term. I know there's
Perfect.
people from DirectTrust
Yeah, it's perfect.
super cringing at the way I'm saying this.
No, it's good.
And I'm telling you, this is how I've learned as a layperson. But what can be sent, it can be very, it can be a CCD, a very defined document, but it can be a PDF. It can be so there's a lot of great things about the flexibility around it because it's not a specific message. So, but we can go more into that. So there's a lot of different use cases, and that's a lot of what we do. So at its core, DirectTrust is a standards organization. So we hold that standard. We're ANSI accredited. So I don't know if those who listen to this may learn about ANSI in school. It's the standards body that issues the standards bodies.
So basically, your organization gets certified to be able to certify other people, other entities for a different, yeah.
And then we trickle it down because then the HIPs can issue things. Yeah. So yeah, it depends on the function. So we're hold, that's the main standard, but there's a lot of stuff that we work on either enhancing how direct is used. So there's a lot of things around like the information exchange for human services. We have that's work that's going on. Event notifications. It's used for a lot of. Of course, I don't have them all up right now, but we're working on a lot of different use cases for that. Always enhancing. We have a lot of directory stuff that's been enhanced. So how can we better have, because that's usually the problem that comes up is how do we find the provider we want to send to? So that's always being worked on to be better. So anyway, standards organization, but also a member organization, kind of like a HEMA, except for our members are entities. So we have organizations who become members so that they can participate in the standards development. And that's done through consensus bodies. These are all things I've learned. So, and those organizations are from health information exchanges to a bunch of EHR vendors to the technology vendors that facilitate exchange. We have areas on aging. We have anyone who wants to use direct for a use case, like wanting to contribute to how it can be better or create a new use case. And that's all around the direct part, but we also have trusted instant messaging that's going on. We're doing, there's a new one.
The one that I'm interested in is that I'm peripherally aware of is the cloud fax standard. I know several of the vendors that are on that group, but just as you mentioned, that's building out that consensus standard, and it's a fantastic opportunity. There was an effort in 2020 that all these government organizations like the NHS in the UK and several of the Australian health authorities were like, we're going to axe the fax. And it's like, well, no, healthcare still loves fax, but what if we modernized fax? And that's what's coming from DirectTrust is a modernized fax standard, which I think is fantastic.
Thanks for the free plug. That was great. Yeah,
absolutely.
That's a big one we're proud of. And honestly, I mean, when I first started working here, I'm like, we're doing fax.
Yeah.
Like I thought we were not exchange. But I've learned so much working here. But what's great about it is it's improving the security and the identity of where things are being sent. So that when you are faxing, it is like, I know exactly where it's going, who it's going to. And I was like, as the, when I was an HIM director and my office happened to be located closest to the fax. And I had so many confessions to my office. My number one inadvertent disclosure was, I just sent this to the wrong place.
Yeah. Yeah.
And so this helps, alleviate that in our modern world. Because yes, we are still faxing.
And it's part of it looking for, and that, I think that's an exciting one because I've listened, and I work for a company that manufactures print devices and fax machines and those type things. And it's like, people are like, well, we're not going to be faxing. And I'm thinking it's 2025 and I can look at the volume of faxing that's occurring at these health systems and it is massive because it's fire and forget. But if you can modernize it, that's a humongous advantage. And you mentioned a story of inadvertently faxing. The problem that I remember always having was the numbers changing. So we had a physician's office that was one of our big ones that we sent op reports to, and out of our dictation system. And I got a phone call from this precious little old lady, and she was like, my phone is ringing off the hook. I just got this number. And I was like, okay, well, let's talk about it. Ended up that physician's office that we were sending op notes to had changed their number. This lady had picked it up, and every 15 minutes, our transcription system's trying to fire a fax report to her. And it's like, so what you're doing, I think, is fantastic. Just in the fax world is going to help out a ton as we modernize these things.
Yeah. And Susan, let me ask before we change topics, you're a membership organization and I know you're growing. How many members do you currently have? How many entities are members for you now?
Oh, I should know that.
I remember the last time we spoke, you'd had a little bit of a growth, and I can't remember what that number was. So you can Google it while we're talking.
I mean, honestly, what I do all the time is everyone's on our website. So I just always am looking to make sure it's like, I think they're a member. Let me check. So it'd be DirectTrust.org. And then the membership, but as far as the exact quantity, I don't have off the top of my head.
Yeah, that's okay.
And it's growing.
It is growing. It is. So my point is membership organization, if you are looking for a way to do DirectTrust, direct messaging, and maybe even cloud faxing, go check out DirectTrust.org, right?
For this audience, identity. So we're starting a new identity provider program, and we have the Pearls privacy enhancing record locator service. So that's when we cross over a little bit with the we're part of the Patient ID Now coalition, like doing the technical underpinning of what those identity and matching solutions could be. So that's actively working on that. I forgot what you just said before that.
No, that's a lot of good work.
That's a lot of good work.
Yeah.
And for us in our profession, that identity matching is huge. I mean, it's just
so important. And the thing, things I learned working here was identity of a person, yes, is important. Like that's the thing I've focused on for so long. But again, like we were talking about the faxes, the identity of the endpoint.
Absolutely.
It's not necessarily about first of all, we got who is that? And then who is that once it's received? So some really cool stuff we've heard, things I've heard about this year, like learning from the remote online notaries, like how they're doing identity, working with these, I learned PKI is not KPI, it's public key infrastructure.
Oh yeah.
Yeah. So
I'm sure that's on blockchain. I'm sure that's on the blockchain or something, right? Don't you think?
It's somewhere in the neighborhood, but that's where I'll fall off real quick.
Okay.
All the cryptography stuff is within there, and I try to join to listen to those things just to one of our work groups is an innovation priority, so we have a work group dedicated to what's coming next, and that's where I learned about quantum computing, which also.
Oh my gosh, so many strides in quantum computing lately. Yeah. So let's talk a little bit about that. So cybersecurity. So we're going to move into, it's more than just tell us what you guys do at DirectTrust, or what are you involved in with cybersecurity? And I say that because quantum computing, I'm pretty sure that it was Google that just had a massive breakthrough in quantum computing. And this has probably been 3 weeks ago or so. And they're at some error rate that is almost acceptable for human decision making from computing. It was incredible, the breakthrough that they've made. So anyway, let's talk about cybersecurity.
You're like, so much there.
Yeah.
But I guess I could do the cyber thing real quick on just what we do around cyber, and then come back
Great.
to that. Because a year and a half, 2 years ago, DirectTrust merged with an organization called ENAC. I don't know if y'all heard of it before. That was Electronic Health Network Accreditation Commission, and they've been around, so which is now we, but had been around since the late 90s. Essentially, they emerged because when the early days of HIPAA, the clearinghouses, there was no way to demonstrate that they were holding to the controls of HIPAA and all
Mm-hmm.
that. So
Mm-hmm.
accreditation need formed. So since then, they added a whole bunch of different programs, and then we folded it. Now ENAC is part of DirectTrust. So we have a whole accreditation arm that's all like privacy and security NIST based, but some other standards too. So, and we're also a high trust assessor. So we have a lot on privacy and security, but then we have all these other programs that have a privacy and security core, but then have special functions. Like we have a health app we accredit, which I think is really important, because how do you know that an app is secure? We have an accreditation for care and code of conduct for patient facing apps. I have
Mm-hmm.
a relationship. So we have a partnership with Digital Therapeutics Alliance. So how do you know that a digital therapeutics app is good? So we're doing that work because they do the clinical, we do the privacy and security. Tons that we do EPC, so electronic prescribing, we do for, we accredit for EHRs because they have to have that through the DEA. So like we have like 20 programs that are of that ilk. So demonstrating how compliant you are with privacy and security, or helping to be that partner. And I just remembered what I was going to say before when I said, what were you talking about, real quick? It was on our membership. Sorry.
Yeah.
Pause. On the membership, I wanted to say that you can be like organizations, our membership pricing is like by type of organization. So like if you're working a health system, it costs less because we want more clinical people.
Mm-hmm.
And then it's by revenue tier. So if you're a startup, it's not horribly expensive to be a member. And even we have individuals who are members too. So that's all. I just wanted to say that we try to make an opportunity for nonprofits and folks that don't have a lot of money to still, we want those voices in the development process for these standards.
Yeah, absolutely.
Yeah.
Thank you for going back to that.
Yeah.
So
Wait,
about cybersecurity,
Yeah.
yes.
I think that I'm pretty sure it was with you in the book club and, Cheryl and Joey and the gang, where we discovered in the proposed rule, maybe for the new HIPAA modernization, the little, very short, maybe 2 sentences that says, CISA, Homeland Security, you have to report a breach within 72 hours. Do you remember that? The cybersecurity infrastructure group that is under Homeland Security, data breaches in a healthcare organization was in a proposed rule, so I can't remember even if it went final.
Was that the proposed legislation? Because I don't think
it was proposed. I'm not sure that it ever made it into final, but it was basically, this was so interesting to me. It shocked me, but also it made sense after I let the shock sink in. So if there was a data breach within a healthcare organization, within 72 hours, you're required to report it to CISA, which is a branch of Homeland Security. And so the best I could surmise from that was CISA is trying to find a place, Homeland Security is trying to find a place where all data breaches in healthcare organizations can get reported to the one place, so they could look at trends to identify potentially the hackers that are maybe involved in that from a Homeland Security standpoint. That blew my mind.
Interesting.
Like,
yeah.
Because that is health information. Like, who reports breaches from a health hospital? It's the HIM people, right?
Yep.
The compliance and or the HIM people, depending on the type of organization or size of organization you have. A lot of times the health information director is also the compliance or the privacy officer. And so we as a profession would be potentially reporting to CISA if it were, in the final rule. And I thought that was fascinating from a Homeland Security standpoint. Like from national security, we're reporting healthcare data breaches. Is that mind blowing to y'all?
Yeah. And I'm pretty sure it was legislation and not a rule. Like, I think it was legislated versus
may have been.
that hasn't come through. But I agree. And that still comes up in the conversations we're having about. So in case for anyone that doesn't know, there is a HIPAA security proposed rule out right now, first time since 2013. So it's a lot of work that needs to be done.
It's time. I mean, can't we just keep rocking?
Yes.
No,
nothing.
Nothing new. Keep moving. Nothing new. Nothing to see.
Yep. But on the CISA thing, there's but that comes up in some of our conversations a lot, like because actually we have a cybersecurity work group as part of DirectTrust. So I've helped coordinate that, and that's like, as we're trying to figure out, like, where do we bring the most value to the community, like what kind of resources are needed, what kind of collaborations are needed, like where do we fit there, because it's like a brand new work group. So it's like we want to have the most impact without not another silo of someone doing a thing that's already being done by this group and this group and this group. So but there is an organization called the Health Sector Coordinating Council. It's public private, but they work with CISA. So there's all the different sectors, so other types of business, so that there is an overarching coordination there. And that's been some of the comments, as we're thinking of how to respond to the HIPAA security rule of, are we, make sure to stay coordinated with, that OCR is not creating things that maybe HSCC already has, or that 405D, there's a thing called 405D. Did you know this?
I don't know this.
For small healthcare providers, it's under HHS cybersecurity. And I don't remember the origin of the numbers of where they came from, but I can always give you links to put in your show notes to these things. But there are a lot of resources that exist, and the gaps seem to be, how do we get good resources between where they live and out to the folks that need them, that don't know they need them. That's the thing.
Yeah, that don't know they're available.
Yeah. Like, why would I know to go look for something? I'm just trying to balance the drawer for today, Yeah.
Right.
Going back to my old days of checking out.
Working at the bank.
Yeah, that's a good callback. That's a good callback.
I loved it.
Speaking of CISA, though, it actually is a good transition to the next question, because that was probably proposed. And Susan, you and I worked together on the HEMA policy and policy council for 1,000 years ago, it felt like. But you see these things pop into legislation or into a rule, and then they get pulled back out, and then it goes back in into a different rule. But we are in the midst of a transition from an administration perspective. So some of these things might come back in, some of them might come out. So what do you see as the future for the next 4 years, at least, for health IT policy with the new administration?
It's funny. I'm gonna borrow one of our trusted advisors that has been saying lately of, my crystal ball is not just cloudy, it's cracked.
It's thinking.
But I do get asked that a lot, because we're working on the HIPAA security rule, and I keep getting asked, like, is it going to get pulled? Is it going to get pulled? Like, do we bother caring about because there's some significant changes of what, covered entities, business associates will need to do to really step it up. And I'm like, I can't tell you 100% that it's going to get pulled, but it's still a worthy exercise, because these somebody is still going to be there, and they're still going to get all of these comments and this feedback. And for us, we're also using it as a really good opportunity, speaking of the HEMA advocacy, of how do we're using the exercise to see, like, what do we think about what they've already proposed, and take some of that and turn it into our own policy statement, like a HIPAA had. So that's my task for this month and then we can take that back to the Hills. So talking about that legislation that we were just talking from last summer to the end of the year, there are 3 different bills that I know of out of Congress that were healthcare cyber related.
Mm-hmm.
None had come through then, but I think that's still a very bipartisan issue. And I think we still keep having that conversation of, yes, we agree. We are a vulnerable sector, super vulnerable.
So vulnerable.
How do you help us? Because that was what, going back to the things I also were a struggle in some of that legislation, because one of them, I don't remember which one, was super focused on, we need to create education and resources. I'm like, no, we don't. We need to get it out there. We need technical assistance. We need people at the like going into places and going, this is how you do it.
Yeah.
And that's, but there's not been funding for that. So that's usually my pitch.
I want to just stick on this for just a minute, because so now we have, for the first time ever, and maybe we could have used this role before, but I mean, I'm kind of thrilled as a long-term health information management professional. I'm thrilled that we now have an AI czar, which we've never had in the presidential administration, right? Now, I happen to like David Sachs. I've been listening to a podcast of him and 3 of his besties for, a long time. And they're all Silicon Valley guys. And so I've learned so much from them, but I like that there's somebody who understands both the power and the responsibility of AI kind of being at that place. I'm not going to say I'm not nervous about what does that mean for healthcare. So I think that we have to stay the course, and I'm not even looking at it from the perspective of, I think there's a lot of conversation about safe AI, unbiased AI, and I think that the creators are really focused on trying to do that well. What I'm focused on from a health information professional is, what does that look like in operations, which is where policy never makes it. Like policy never goes down into that operational component where we can actually execute some of this stuff. So what are your thoughts on having an AI czar, somebody running AI, somebody being part of the presidential administration that's helping with shaping that policy, which we've never had? The EU, by the way, is leaps and bounds ahead of us on policy. Not that they're doing it well completely, because I don't think that they are, but it's new. So none of us do it well the first time out. So what are your thoughts on having an AI czar? And especially, what do you think it's going to do for healthcare or to healthcare? I guess.
I haven't followed it that closely. My first thing that comes into my head is, what's that scope? I mean, it's
massive.
AI. Like AI is going to eventually be ubiquitous. I mean, it's part of
it's an umbrella term anymore.
Right.
Yeah, that's right.
Well, except for there's no guardrails yet. No real guardrails in healthcare for it yet.
Yes,
I mean, there's a few.
And then the folks, but they're not all fully recognized. I mean, there's like a little bit built into like the certification standard.
A little bit of NIST, a little bit in HTI 1,
A little bit of that. Yeah, we got the framework from the NIST and the HTI and
ONC even.
Yeah.
Mm-hmm.
Well, and I'm not even going to get into, we don't know who they're going to be in a minute.
So
are
true.
they going to be there tomorrow? I don't know. But in the absence of that, there are organizations who, like, do you guys know about CHI?
Mm-hmm.
Yeah. So the AI, but
CHAI is, I think.
CHAI, Coalition for Health AI.
Mm-hmm.
Oh, okay. That's a new one for me.
It's pretty good. Yeah,
I've had the drink, but
yeah. This is not tea. You can't make a latte out of it. But I'm sure AI could tell you how. But it's they have some really great framework stuff they've they've built and asked for feedback on from the community. But what was interesting that I think there was some pushback on, because they want to create, they called them AI assurance labs. So like still essentially like another accreditation, which I'm all for. Like somebody's got to say whether this is, people are holding to what they're supposed to be holding to. What are the controls? What are the, what are the testing procedures? How are you testing? How do you know that it's good? And who's checking that? And so I'm for that. But then there was some pushback about, there's always in this, I'll bring this up because I'm talking to the California Association tomorrow, but this is the thing it's this balance between, we need the guardrails, but then somebody's screaming, but you'll stifle innovation.
And there is a very thin line between those two things. And that's really what I'm excited about, having David Sachs there. I'm excited that he knows so much about how innovation works. What makes me nervous is, what does he really know about healthcare policy? That's my, and how to operationalize that when you get down into where healthcare providers are. But that's true of anybody that would be in that role for any administration, because this is new for us, So I'm excited, but also a little nervous. And at what point do we just recognize, kind of like what you said a minute ago, Susan, it's AI is the new internet. Like, I feel like I'm moving from dial-up to fiber, like in this time instead of 2 decades, right?
What's happened to the dial-up accreditors? Where they go?
I still have all my AOL CDs to get my minutes. That's an old reference, and a lot of our audience are students, and they won't get that reference. Yeah, that's a painful one. It sounds like we truly need a Health IT Rockstar to represent the HI profession in the future of what this is. So, I mean, Susan, you're the perfect person for it, and we need 1,000 more of you to go out there and represent.
David Sachs, then, since you're friends with him.
I'm not friends with him, but I wish I were. I would love to go eat at the Navy mess hall at the White House, and you could get me in, but he's not my friend. Maybe if I say, hey, all in, come check this out. I'm touting your podcast. Now feed me. Yeah,
exactly.
Yeah, I'm actually really proud that, so the Senate did an AI roadmap last year, and one of the authors was one of my senators, and that, which is notably also my birthday buddy, month day and year. So we have a special bond. But so there's been some cool stuff done. So this is an opportunity when we go. I don't know if y'all are going to the advocacy summit this year for HEMA. I don't know what our topics are, but I know the Matcha Act's coming back up. But I think if it's not on this, then also DirectTrust is working on trying to figure out when we can also go to the Hill, which will have overlap, and then we can echo these conversations. So again, it goes back to making those relationships, and I'm happy to be your rock star on the Hill. Send me to Washington anytime you want. I will talk to anyone.
I know. I love going to DC. A couple of things about that, though. Unless they've changed their schedule, I do believe that they're on break. I believe Congress is on break that week. Is that still true, Seth?
They are, yeah. They're on spring break that week, so most of the HEMA folks will be meeting with staffers.
Yeah, so, just with staffers.
It's okay.
Staffers anyway.
Half the time you meet with staffers anyway. We usually get really lucky with Tennessee and get to meet with our our national representatives. But if you meet with staffers, you're still getting the point across, and they're the ones that really dig into the issues anyway.
Yeah, the LAs are the ones that are in the middle of it. And then what we're encouraging in the state of Tennessee is for folks to go out and visit the reps locally, because while they're on spring break, they're going to be in their offices locally. So schedule meetings. And that's, I think when this episode posts, Advocacy Week will be the week afterwards. So go make an appointment with your representative and be a part of the HEMA Advocacy Day. Even if you're not in DC, you can do it in your local office.
So true. That's one of my success stories. It finally it doesn't work there anymore. But I met through when we had to be virtual for advocacy, like we did a web one, but I met the local person for my house rep, and we ended up talking about IPAs, the beer.
Wait a minute.
It's
Wait, not the initial public offering of the IPO. You said IPA beer.
IPA,
Sure.
Like a healthy adult beverage. And so we bonded over that. And then I followed up with him, and he's like, well, when he would come to our area and we'd get coffee. He brought me a beer from one of his trips to Washington.
That's great.
Yeah. So, and we just formed I just always want to be, and you can do that on your super local level too. Like I have
you should
with a friend that she'll text me, or I message her. We have a new AI. That's the thing you got to watch out for too, is all because we don't have national thing like that cyber stuff we talked about, how they introduce all these different bills. We don't have a national data privacy thing. So all the states are like, we'll make up our own then. And then
which makes it even
more complicated,
incredible, and impossible to keep up with. So, well, Susan, thank you so much thank you for joining us. I love when you come on. You're always doing something interesting. You are always interesting. Health information professionals can do what Susan does, can be a health IT rock star. It does take what you know now and then put it on steroids to learn some of the technical things. But that's where our future lives, is in that intersection.
You don't have to be super technical. That's the other thing I'm here to tell you. I've told this to students before. I don't code. I mean, I don't medical code, and you don't
code anything, neither does Seth.
Anything. I just translate. I know just enough.
I will tell you, I used ChatGPT to create some HTML code for me to put on my website. I did that all by myself. I was like,
very good.
I told my business partner, who is technical, and he's like, oh, okay, superstar.
I would be proud. I would definitely be proud of that.
Yeah. Well, this has been great. Thank you so much for coming back. If you want to get involved, DirectTrust.org, and you can reach out that way.
We have a conference first week of August. It's going to be on identity, security, and interoperability. St. Louis.
Where is it? St. Louis. Okay.
St. Louis. Come see us in the Midwest. It's going to be a fun time.
Okay.
Fantastic.
Very good. Well, thank you for coming, Seth. What you got?
Nothing for you. That was great. That was a lot of fun. So thanks again, Susan and Shannon. Until next time, my friend.
All right. See you next time, buddy.